So my name is Tander Simberloff, and I went to med school here, and I'm coming back to work as an internist, both in the hospital at Johnson City Medical Center, at Holston Valley Medical Center, and then I'm also going to be spending time in the Ballad Palliative Care Clinic. So I became a doctor mainly because of experiences with my grandmother growing up. We were very close. She suffered from dementia, and I just was watching her lose her autonomy and her independence. Both of those were so critical to who she was as a person. And when I saw that happening, I really wanted to try to find ways to empower her. So I first went and I did a residency in internal medicine after going to medical school to try to get a better understanding of what was driving the disease processes that were kind of making it so much harder for her to function. And then I went to a fellowship in hospice and palliative care because I really wanted to learn how to improve the lines of communication between doctors and their patients, and also to give patients control when they feel like they've lost it, which is usually the case with patients who have serious or terminal illnesses, and honestly, even when they have less serious illnesses but are thrown into the midst of the healthcare system. The most rewarding part of my job, it's I'm gonna say connection, which is such a huge term, but I mean that in many different facets. So it's not just connecting with the patients and really feeling like not only did I make a difference in their lives, but they made a difference in mine. But also within the healthcare team, fostering those connections between mentors and the people that I'm training, between them and their patients, so they feel like they're developing these meaningful connections with the people they're serving. And then also just working with the entire healthcare team in general, not just physicians, but I'm talking about the nurses, the physical therapists, the occupational therapists, the pharmacists. Everybody needs to come together to be able to give a good experience in this day and age, and I feel like that connection is really what drives good healthcare. I think that one of the biggest goals I have for my patients is that they feel heard by me. It doesn't mean that I'm always going to be able to fix what is ailing them. In many cases, I'm not. We are living in an era now where there's many diseases that we can't cure, but people can live with them. But I think being able to make sure that patients feel seen and respected by their healthcare provider and that we're listening is incredibly important. And I think just because of the nature of the busyness of the hospital, in the clinic, sometimes patients feel like they're not being seen by their providers. And I think that's at least the least that we can do is make sure that they feel recognized as a human, and just showing up for them in that way. So while I might not be able to take all the pain away or take whatever symptoms are really distressing them, I want them to know that they're not alone and whatever they're facing. And so I hope to be able to provide that to them, and to also pass that on to the learners that I work with so that they can also take that back to their patients. Like I said, I went to medical school here at Quillen College of Medicine, and one of the things that drew me to this place for my training was when I drove in, just seeing the mountains all around me. They give me such a sense of peace and calm, and I think they give a lot of people in this area that same feeling. And just being able to train in that, as hectic as everything else around you can get, being able to look out and see those mountain ranges is literally the best. I've gone far and wide now for training. I went to Florida to do my residency, and I've been up into the Northeast to do my fellowship in Rhode Island. But these mountains keep calling me back, and as cliche as that sounds, it really is true. If I'm not in the hospital or in my clinic, you will find me out there hiking, or on my porch just looking at them, usually with a cup of coffee. But yeah, that's really my favorite thing about living up here. Hi, my name is Dr. Tander Simberloff. Thank you for choosing to spend some time with me, and thank you for choosing ETSU Health.